Come in.
Hi, I'm Kristen. I'm going to be your student nurse today. Can I get your name and date of birth, please?
Trista, 10/17/1924.
And what was your last name?
Vandell.
Perfect, thank you. That's what I have.
Okay.
I'm going to lower your bed and just make sure that you're in a safe position. Do you mind if I shut the door? Give us some privacy? Perfect. I'm going to shut that and close the curtain. So the reason why I'm here today is we're going to be doing a head-to-toe assessment. You are considered in the geriatric, so we're going to be focusing on that in our assessment.
Okay.
So first I'm going to do your respiratory. So I'm going to have you go ahead and take off your robe if you are going to be comfortable with that. And I will be palpating and using my stethoscope to listen to your lungs.
Okay.
Perfect. Thank you. All right, so now I'm going to start doing your respiratory assessment. I am going to place my hands on your back and palpate. I'm going to be checking for any masses or any tenderness, so please let me know if anything is uncomfortable or hurts.
Okay.
How is that?
Very good.
Wonderful. Everything looks symmetric, no tenderness, and I don't feel any masses. Now I'm looking for your AP ratio, and it is 1:2, which is good. Now I'm going to place my hands on your back, and I'm going to have you breathe in and exhale. Perfect. One more time. Inhale, exhale. Everything looks symmetric and equal. Now I'm going to listen to your lungs. I'm going to have you breathe in and exhale every time that you feel my stethoscope on your back.
Okay.
Good. Again. Last one. Good. Everything sounds clear. There's no cracking or any murmurs. So the reason why I am listening for respiratory is because in geriatrics, you have less lung recoil and elasticity.
Okay, thank you.
All right, Trista, for the next part of our assessment, I'm going to be asking you about your mental health. This can be uncomfortable, but we ask everybody, and it is best to answer as honestly as you can so we can get you the help that you need.
Okay.
I'm going to be using the PHQ-2 test. It has 2 questions,
Okay.
and this is going to be over the last 2 weeks and how often you have felt bothered by the following problems.
Okay.
So the first question is, have you had little interest or pleasure in doing things? 0 is not at all. 1 is several days. 3 is nearly every day.
0.
0, not at all. Okay. Second question, have you been feeling down, depressed, or hopeless? Same scoring. 0 for not at all, 1 for several days, 2 for more than half days, and 3 for nearly every day.
0.
0. So you would score low, and we would not do any further assessments unless you felt the need to reach out for mental health issues.
Okay.
This would be another good time to ask if the patient feels safe at home, because elder abuse does happen, and it's usually is the caretaker that they see regularly that is the one with doing the abuse. My next assessment is going to be using the CATS testing, KATZ, and that's going to be for your activities of daily living. So I'm first going to ask you for bathing. Do you need help bathing, or do you do that solely on your own?
I do it on my own.
On your own? Okay, that's 1 point. For dressing, do you get clothes from the closet and put them on yourselves, or do you need help?
I do it myself.
Okay, that's also 1 point. Toileting, can you go to the restroom on your own, or do you need help?
I go on by myself.
Okay, 1 more point. Transferring, when you get in and out of bed, do you need help doing that, whether it's another person or a device?
Nope, I can still do that.
Okay, that would be 1 point. Continence, Do you exercise self-control over urinating, or do you have bladder and bowel issues where you have problems holding it?
I can hold in my urine.
Okay. Feeding, can you get the food from the plate to your mouth okay? Do you have any trouble eating or need any assistance?
Nope, I do that just fine.
Okay, it's also 1 point. So 6 is the highest and 0 is the lowest, and you've got the 6, which is highly independent patient. So Trista, for joint commission, we have to do a pain assessment, and we do this for all of our patients.
Okay.
And today we're going to be using the long Baker faces.
Okay.
And I'll show you here. There's 0 smiling up to 10, which hurts the worst, and he is crying.
Hmm.
Which face do you relate to the most?
I think I'm at number 2.
Number 2 hurts a little bit. So
Yeah.
what is hurting you?
Well, I have arthritis in my hips.
In both hips, bilaterally?
Yes.
And what does that pain feel like?
It just feels kind of dull and achy.
Is there anything that helps relieve that pain?
I take some Advil a couple times a day.
And what seems to make it worse?
Lots of activity.
More activity?
Mm-hmm.
Okay, thank you. So Trista, this part of the assessment is for fall risk, and geriatrics have more of a fall risk because of imbalance and musculoskeletal. They are weaker muscles, and the bone degenerates and can make it more of a risk to fall.
Okay.
So with this assessment, I'm going to be using the Hendrich fall risk test, and I have a few questions to ask you.
Okay.
Do you feel confused at all or disoriented?
No.
Do you feel depressed?
No.
Do you have any dizziness or vertigo?
No.
Do you have any altered illumination?
No.
And if you are male, you would automatically get a point. Do you take any anticonvulsants?
No.
Do you take any benzodiazepines?
No.
Okay, so the next part of our test is get up and go. So Trista, for the get up and go test, I'm going to be having you stand up from your bed, and if you feel woozy or dizzy, please let me know and we will stop the test. But I am going to be observing you and seeing if you can get up in one smooth movement.
Okay.
Okay, so whenever you are comfortable, you may get in the standing position.
Okay.
You may sit.
Okay.
Perfect. Do you feel dizzy or anything like that?
No.
Wonderful. So the Hendrix risk fall test, you score low, and I do not consider you a high risk for falling.
Okay.
If you did, we would get you a wristband and also a bed alarm.
Okay. Thank you.
Thank you. For our last assessment, I'm going to be asking you some questions about nutrition. Being geriatric, sometimes it's hard to swallow, and that can require a different diet and a referral to a dietitian.
Okay.
So do you have any issues drinking water?
No.
Do you you drink water, do you cough or dribble, or does it feel like it gets in your cheeks versus swallowing?
No.
Do you have any trouble chewing or swallowing solid food?
No.
Okay, wonderful. If you did, again, we would refer you to a dietitian where they could give you a specialty diet.
Okay.
And that is going to conclude our assessment today. And I appreciate your patience and answering everything so wonderfully. Do you have any questions or concerns for me?
I do not.
Okay, I'm going to lower your bed into a safe position all the way down, and I'm going to give you your call light.
Okay. Thank you.
You're welcome. If there's anything else, just let me know, and I'm going to wash my hands and close the door on the way out.
Great. Thank you so much.
Thank you.